So this is, here's my disclosures. Let's do some definitions. We've been, I think, somewhat interchanging some of these, but augmented reality is the Pokemon, that Dr. Donnelly showed you. It's taking a digital world and overlaying it onto the real world. Okay, that's augmented reality. Virtual reality is where you're entirely immersed in a digital world. Mixed reality merges the two of them, and it allows you to bring a digital world into the real world. And the neat thing about that is that it allows the user to manipulate and interact with both the digital world and the real world. And that's what XX does. And here's an example of what's happening with it in my operating room. Christian, my tech, it's on a loop here, but he's basically interacting with a digital checklist, if you will. That's what's going on in the surgery. And that's important right now. We're gonna talk about why this is. The creators brought this into realm here. Surgical care is at a crossroads. Surgeries have become increasingly complex, as demonstrated by the volume of cases, different cases, and different caseloads. More tools than ever used before, and staff turnover is tremendous as well. I just have to show you this card, and you'll know what I'm talking about. This is the essence of what XX does in terms of the mixed reality part of it. That's your white card, and it hasn't changed since before the jet airplane was invented. And all I need to add to the confusion that creates, because you walk into your OR as good as it is, and it does not matter what happens. It's disorganized. You all get it. And I love to optimize my flow, big time. I love to optimize my flow. I only need to add one word to this, and you'll all get it. Traveler. Okay, you say that, and then boom. And it's not their fault. This was going on well before the traveler. XX takes this and allows. It basically, you create a digital fingerprint, if you will, or a digital template of everything you do. So at its basics, you take your Creator X mode here, and you build out your trays, your Mayo stand, your kit, each step of the way. So for myself, I would take, for example, disc arthroplasty, incision, approach, retractor placement, disc space preparation, decompression, the stabilizing device, whether it's an artificial disc or whether it's a cage. Every step of the way is put into this, created into this new checklist and tray item here. And then you have the viewer X where you can view it and you can see how it lays out. So literally you take your entire procedure and put it out on this virtual space. So it's sitting in, that's what Christian was looking at. Christian was looking at the Mayo stand. He was looking at every step through that lens. What XX does with that is then it takes it, it makes it mixed reality by bringing that to the sterile field. So here it is. This is actually going on. This is what the view is. This is what my tech is seeing as he looks through this. Comes in a room and has prepared all of this, and you can see the Mayo stand. You can see the different elements of it. As we're doing procedures, he's checking them off. I know nothing that's going on. The surgeon has nothing to do with this other than we participated in making our life easier by going along each step. And the more information you can give this, the more information the AI will give back to you at the end of all of this, at the other side of the story. You can see each imagine that you have all these different trays, and instead of rifling through, where's this instrument or where's this instrument, they're lighting up in the background, and the tech knows right where to go each step of the way, and he's checking them off. Each checklist goes. Here he is in my OR doing the same thing. I'm just operating. He's going to be like checking off his cases, handing me the instruments as they're happening, and going through my case. Once you do all of this, it's keeping track of everything. Okay, it's keeping track of what instruments are being used, how many times they're being used. I'll give you an example. In one of my cases, we just had it create an operative report, and it was meticulously accurate in terms of like pituitary, which instrument was picked up, which instrument was used, how many times it went in, things like that. Then it was like, Jeff, it took you, or Dr. Larson, it took you 48 seconds that time for disk-based prep. So you know where this is going, and the ability for we don't know yet what the AI is going to do. AI is very data sensitive, so we need all of these cases to come in and feed the data to it, and we're starting to get those. I say we. I'm one of the users. I was the second site that was involved here. It's now expanded into many more sites, which I'll show you. But this is the artificial intelligence part of it. What it kicks back right now is optimizes the procedure in terms of how you do it, and disposables are a big thing. It'll keep track of what you're using, so what's being opened and what's being used, so you can have your institution save on that regard. It's here now, and we're using it, and it's making flow for me. It's really, it helps it flow. Like, for example, I'll give you an example that happened real world. So I started out by doing microdiscectomies on it. Quickly became apparent to the tech, not to me, that I noticed somewhere along the line, it got a dural laceration. Not a problem. He had already created, they thought themselves, this is going to be great for dural tear. They knew exactly what to open. As soon as they got that, they just started mobilizing. I didn't have to say, here's what I need. They knew it. It all came in a room, and then we just kind of worked through it. So flow's better, organization better, my efficiency's better optimized. And with that, in terms of the hospital setting, increased profits by using less consumables if you don't need them. It really helps me in the ambulatory surgery center, where we happen to have a autoclave sensitive situation. I don't have a whole bunch of autoclaves, and these stacks of trays that come in for all these procedures take up a lot of autoclave. So now we have my instrumentation streamlined into what I actually use. Less medical errors refers to not errors that we make, with ourselves, but has to do with how the scrubs are setting up, how the techs are setting up. Because I'll show you, this is a kind of I'll show you a real life example, or a virtual example of how this happens, and you can kind of portray how this will go. But here's the partners now in this, or the people that are involved in this. Texas back, Richard Geyer is involved, and I was going to tell you, you could check with his tech. I think her name is Devin, on her opinion of this. It's you see what the scrub side of it is. This is kind of what happens here. The tech will come into the room. There's QR code for each case. The QR code, the iPad gets hit, it sets it up. There's the case. They're looking at it. They can position the OR. You know where everything's going to go for that particular case. You know where the C-arm is going to go. You get one of those flow radiology techs that come in. You tell them where to go. What part are you doing? This is all happening. That's what Christian was doing in the sky with his finger touching off the tech, ticking off the things, being told where the next instrument is, passing it on. Just accuracy, like a pilot and his checklists. Boom, 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 every step of the way. There's your digital twin, if you will. Every instrument, every single instrument that you can think of is uploaded onto it. So your effort is at the front end, just putting your cases together, how you do them. Doesn't matter who's wearing it, same thing happens. Thank you.
So on the demo, it almost looked like it had an overlay of the spine or the pathology. Is that like a future iteration?
I think this is a little virtual cue in there, yeah.
I didn't have any plans
No.
to be into surgery.
I don't know. I really am not that. I got involved as a site, and then I said I like this, and then I got involved. Otherwise, I'll tell you where this is now we're off of talking about XX, okay? But what I see in this is it flow. For me, it's absolute flow, and you can reverse engineer. We're off XX. This is not XX, but you can hypothetically, you could reverse engineer your surgeon. This is going to create best practices, and it's not going to. There's no danger of you being tagged to a bad event or something like that. But you're going to know. You're going to know by comparison to everybody else who's doing this. It's going to figure out what a best practice might be, and you might know that if you put metrics on the surgeon, if you put metrics in a room that's measuring everything from the song that's playing to the surgeon's heart rate to when things are happening, how it's going. So ultimately. Yes.
So this is pretty cool, and I like the idea of setting the specs up for success. When I'm operating, it is not uncommon due to work laws, for me to have 3 separate crews come in,
Absolutely.
one person sets it up, another person scrubs the first half, and then they take a lunch break, and someone else comes in and finishes it. And that's the nurse and the scrub tech. How many headsets do you have in your plan?
The tech wears it. It goes on a tech.
Yeah, I've got techs scrubbing in and out of cases.
They just swap it. The tech is,
Oh, okay.
it's all on there. It's
just seamless.
Yep.
All right.
Yeah. I'll tell you a scenario. I mean, this was yesterday. A colleague, a neurosurgery colleague, texted me, Jeff, what's the name of that company you're speaking on behalf of up at the meeting, the cool spine stuff meeting? I'm in this intense meeting right now about that incident I told you about. Well, the incident was a cranie for a hemorrhage that had a 37-minute delay on it, tagged to it, based on the fact that everything was prepped. There's 10 different people doing things at a big hospital, but the drill bit and the drill did not match. You couldn't turn a flap. You can get a hole in it, but you could not turn a flap. And this is that. But really, it's, even though I'm at a surgery center where I know all the techs, they know how it goes, this changes the pace of the room. It changes it, and it's not a big learning curve. You're dealing with software and hardware, so you have all software and hardware things to worry about. But the flow of the straightforward cases that I do, outpatient ACDFs, outpatient disc arthroplasties, outpatient microdiscs, the fact that the room is set up and they're basically simulating the surgery ahead of time based on what opened up in front of them. So,
I think this is, Jeff, this is great talk. These are those kinds of talks where it takes me a while to really understand what this is. But when you understand it, you're like, holy cow, this is very applicable. At Cedars right now, we have 25, 28 spine surgeons, and the cost variability for a standard microdiscectomy case is all over the board. We have people who can run it in at $600 a case, and we have others like Pat Johnson who are at $2,600 a case. And
Add some zeros.
the reality is that a lot of waste of things that didn't need to be opened. And so I could see this being a way to just continue not only describing what the issues are across all surgeries in terms of variability, going to the fact that having a standardized case for the surgeon so that the surgeon feels like they have all their equipment. But I'm thinking bigger term, like being able to say, hey, everyone should have this kind of standard set. And if you need an additional piece or item, you can tag it on to your, exactly. Go back to that other slide. If you, that one, you go back, if they needed something else.
yeah, it does. This is completely user friendly. So what the tech gets is creator mode and creates whatever you want or they want in some regards.
But then the hospital administrators can use this for like even more complex surgeries like fusions, like, what kind of bone grafts are, just a way to track it well so that they can try to, that's what we're doing right now is we're trying to cut costs because it's just, there's just so much waste and so much variability. People are putting in extra large BMPs for one level,
Yeah. Yeah, you'd have to be able to determine, it's easy to say if you've opened up 2 gel foams or 2 surgery flows or whatever, choose a product, right? And then you only used one because it's checking when you used one. And so it knows, it comes back to you. That's what the AI gives my center. It tells me disposables and it tells me instruments. So I cleared out a bunch of instruments. I made it much more streamlined. Now let's talk about, if you're talking about hospital administrators looking at this, think if every surgeon had their footprint in here and you happen to have a locums neurosurgeon coming in through taking call. The turmoil that goes through to try and figure out what that individual needs, so there's benefits. But everybody in this room can benefit from flow in their OR and consistency in their OR. And something you can go through all the training in the world and for techs, and it's just not going to happen. You're going to come there and you're doing a lateral and the table's backwards, or something that throws you off, and it's just no bueno. and this is made it.
So
Better.
Jeff, you're right. I do like your talk and I'm happy to hear it. We were texting and emailing back and forth, but how much does this add? I know how much it could add to the hospital's bottom line, but how about to your time bottom line? I mean, does this, it looks like it could improve your support people, just making things efficient for you. How much time do we stand around and wait for stuff?
There's nothing. I mean, there's no, well, so you take now as you convert your worst case scenario to something where it's all, it's no, I mean, it's no more. If as long as they're,
Per disc, no longer an hour and a half, but an hour and 10?
well, certainly,
Does your T lift go from, 3.5 to 2? I mean, those are,
I'll tell you what goes away. What goes away is this. Oh, it's in over there. Or where is it? Or because everybody cues off of this. Everybody cues off of the vibe in the room. Everybody knows. Like the tech, I might notice in my room, whereas we're well known to each other, I might notice that they know when the music is turned down.
okay.
Tech gives the cues. They speak tech and circulator. We don't.
Looking at what's on a text tray, okay? When those guys come through your operating room and 3 of them are there during, an hour and a half case or whatever craziness that is, how many times do you ask for a Freer, or a Woodson, and they can't find it? I mean, I'm just talking about
It lights up.
the front tray.
If you have, yeah,
The tray that's right in front.
it does. No, you can have it. It'll tell you where it is. It's set up. It tells you it's gonna.
How many times have you said, just leave the instruments here and I'll get it myself? No, this is really cool. Now, great. I like this. I'm like totally turned on to this idea. Now, is this yours? Like let's just say hypothetically you lived a vagrant lifestyle and you're going from hospital A on Monday, hospital B on Tuesday, hospital C on Wednesday. Do you take this with you, or does each hospital system have to have their own? And then my ASC on Thursday, do I have my own and my ASC on Thursday? Or am I like bringing a briefcase? Boom. All right, tech I've never met before. Throw these glasses on. We're going to do a case together.
I don't know the business model of the company. I don't
Take it
know.
with you. Is it portability?
But
If you work,
but I can tell you that if we have a so it's not they chose as they're currently using HoloLens 2 is the current, but it would work with any, they just chose that one. It's a software. It's a software based product, and the AI is what they're programming in, so that is going to be based off the data, right? But I mean, there's nothing other than a strong wireless system. But if I'm wrong, let me know. But I don't know what the business model is in terms of.
Can I get this for me? Grab 2 headsets, purchase a subscription to this, and go and make my life better everywhere you go? Or do I have to one place and live great?
I believe so.
very good salesman.
I'm not saying. I know that I'm not. I'm not. I got involved once I saw it. I said I'd like.
It's here.
It's here. It's back there. You can see how it works. Here.
I'm coming your direction for spring turkey. I'm gonna scrub it.
You want to be the tech? You want you come? Spring turkey. I always root for the turkey. If you're up in a tree, don't blame me. So yeah, it's exciting. Again, the mixed reality portion of this is that you take this virtual world that you've digitized yourself, you've created yourself. I think what the company must have, if there's 2 million instruments available in the world, they probably have like 1,500,000 of them, already loaded into the system. So it's kind of like, what pieces do you use? You can apply it so for example, if I'm doing a disc arthroplasty and it's, I try to stay in the FDA guidelines and those. So if it's 2-level, use a 2-level disc. They know that there's different templates for Mobi C than they'd have for Pro Disc C. So they just kind of flows. It's pretty cool. I was really impressed when they created the dural repair tray, on their own, and And honestly, they asked, hey, can we get in on this? Because it's, they liked it. So not a lot of headache.
So coordinators can't complain your pick list is wrong anymore?
That's the same thing. I don't know what year that was, but that's pre-jet airplane, I think, stuff that we're following. Yeah. Yeah, and the common theme in the panel was planning and implementation. Planning and implementation. How do you do it? Well, this seems, we'll see what the AI gives back to us once the data shows up. But so far, exciting. Thank you very much, everybody. Thanks for staying around.
Well, I think this is it, unless anybody wants to go enjoy the lab. But I appreciate all the faculty and all the participants for coming out today, and we'll see you next year for the 9th annual.
Great job, Danielle.
Thanks, everybody.